Everyone, I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. So in this video, we're going to see about the condition. It is a case discussion about the patient who is diagnosed with a condition called as Bell's palsy. So generally, Bell's palsy. What is Bell's palsy? Anyone know? Yeah, very good. So Bell's palsy is nothing but an injury to the seventh cranial nerve, which is known as the facial nerve injury. Okay, so this Bell's palsy, it is a condition where the seventh cranial nerve gets injured. So generally in this condition, the opposite side of the face it get deviated. Affected side it getting facial muscles get dropped down, and whereas the opposite side of the facial muscles were getting deviated to the opposite side. So I have seen a patient during my internship period. She is around 65 years old female. During a month of winter season, she went to travel for some temple pilgrimage trip. While returning from there, she came through the bus, and after the trip, while returning back to her hometown, she exposed to the cold weather wind conditions. So due to that, she has been affected by the Bell's palsy. So when this patient came to me for a treatment, so first for the Bell's palsy, we have to go for treatment purposes in an electrotherapy is nothing but the Faraday current stimulation. So generally, the face have these major muscles, and the major muscles have the specific motor points. So especially for contracting and for re-educating the muscles of the facial muscles, we have to give the Faraday current muscle stimulation to the particular motor points. So generally we have to stimulate the muscles such as the orbicular oris. So this is one of the major muscles which surrounds the eye region. This orbicularis oculi muscle mainly helps in the lifting up the eyelids. So if the patient is affected by the Bell's palsy, they have been clinically one of the major clinical feature, which is nothing but the dropping of the eyelid. So correcting the dropping of eyelid, we have to stimulate the orbicularis oculi muscles. In Faraday current, we generally give up to 50 to 100 contractions per muscles. After that, she have a major complication, which is nothing but the drooping of the saliva. So this drooping of saliva is nothing but the mouth muscle gets deviated, the dropping. Due to that, we have to stimulate the muscles which are surrounded by the mouth. So generally we have to stimulate the orbicularis oris muscle, buccinator muscle, and also well as mentalis muscle. So these muscles majorly help in maintaining and also regaining the back to the normal facial features. So we generally stimulate these three muscles. Each muscles have been stimulated for the minimum of 50 to 100 contractions. So while giving this treatment, she automatically gets regained their muscle properties. But not only this electrotherapy will help to regain complete recovery, we also have to do a manual massage therapy. So generally this massage therapy mainly gives them an effleurage type of technique, effleurage, rinking, and as well as also tapping technique over the facial muscles. It helps in the blood circulation to the muscles which are surrounded on the affected side of the Bell's palsy patients. Okay, then finally we also give a taping technique. So this taping technique which helps in the regaining and repositioning the alignment of the faces. So this technique is generally given in the two types, X type of taping and as well as also in a Y type of taping. Generally these taping techniques helps to realignment in their faces. Okay, so finally this Bell's palsy, if a patient is affected by the Bell's palsy, we have to find out whether it is a Bell's palsy or a facial palsy. So there is a main and major feature which is known as the Bell's phenomena. So the Bell's phenomena is nothing but if the patient having the dropping of eyelid and also the drooping of saliva which deviated of the muscle, if the person is having these type of clinical features, the patient is affected by the Bell's palsy. Okay, so we're going to see about the different types of conditions on the next other videos. So thank you for this video. Thank you.